Hello, everyone, and welcome. I'm Dr. Johnson with Alterman and Johnson Family Chiropractors, and this is Q&A with Doctors A and J. And we have today Dr. Adams with Full Circle Women's Care. Dr. Adams, hi, thanks for joining us.
Hello, thank you for having me.
You're so welcome. I'm going to ask you in just a minute to tell us the story behind how you came to realize this dream of the practice that you have, but I want to first introduce this series. So we are bringing in local experts, professionals, practitioners, providers, teachers to share as many resources with people who, are largely in their homes right now. And we're just looking to connect people and information and resources that are in line with what we do as chiropractors and a chiropractic lifestyle. So again, thanks for being here with us. I
Awesome.
am curious to know the story. Something had to have provided the impetus behind you stepping into the model of OB practice that you have today. So, can you share that with us?
Absolutely. So it was a journey that actually probably started before I was born. Didn't even realize it. I started out actually to be a chemical engineer, and then got to school and realized that I was more interested in interacting with people than with electrons and nanoparticles, and kind of just switched gears and went pre-med. And then, in medicine, you kind of get to see each different field. So I went through pediatrics and internal medicine and general surgery. And the only thing that I loved was delivering babies and taking care of women. So went into OB, and then very shortly, I'd say probably during residency, ended up talking to my mom, and she just kind of casually mentioned, "Oh yeah, my mom used to deliver babies too." And I was like, "You never mentioned this." And she said, "Well, yes, her mom was a granny midwife, and then she trained her to be a granny midwife. And my grandmother actually delivered me and all of my siblings at our family house in Alabama." She's like, "Yeah, this was kind of in your blood. When I saw you headed this direction, I was like, oh, I'm not surprised." She said, "I don't know why it skipped a generation." But to find that out, that the women in my family have been delivering babies for over 100 years. And that my grandparents' story is, of course, a lot different because of when this was happening, late 1800s and early 1900s. They were it. There was no rescue for maternal issues or fetal issues. They just did the best that they could with the tools that they had. And it just kind of felt full circle, if you will, for me to be able to see women through all phases of their lives, and to be able to help women who have high risk issues and babies that need additional and special attention too.
That is such a beautiful story. So, um, in a different model, you're the current day granny midwife.
I kind of like to think so, and we are, yeah, we do have practiced the midwifery model of care here. We do stratify care. The midwives are in close contact with all of our moms, because some part of your pregnancy is normal. Pregnancy is emotional and it's physical. And we don't want people to get so bogged down in, if there's a physical issue, that they lose the emotional aspect of just being happy, but being able to find that joy that they're carrying a pregnancy and growing their family and celebrating a new life.
Yeah, yeah, wise words. So I have to say that how Full Circle has been in existence since when?
We officially started in 2014. So June 1st is Full Circle Day, and we turned 5 last
Yes,
year.
yes.
But before that, we kind of stand on the shoulders, the legacy of A Place for Women, which was Dr. Van Scriber's
Yes.
practice, and she delivered my oldest baby shortly before deciding to move. And on her way out, said, "Hey, do you want to practice?" And I was like, "Absolutely not. I have a 13-month-old. I don't want to start this. It seems like a lot of work." But it just ended up being the right thing to do at that time, and we started with just me and Lauren, who a lot of you all all know, has been here and had been here for many years with a place for women. And then we grew. We've had a couple midwives in and out, Nicole Thomas and Jordan Skis, who aren't with us anymore, but we've got Carol and Kim and the amazing Cindy and Dr. Marrow, and the family has grown, and everyone's been just a really amazing addition in their own right.
Well, we are grateful for Dr. Van Scriver's shoulders and pulling you in. And I just have to say, I don't know how you would describe your model of practice, but when I have a pregnant mom come in, I breathe a sigh of relief when I hear that they're with your practice, because I just know how mom-centered, parent-centered you are, and how you support these women. And so I'm really, really grateful for you and your practice.
Well, thank you so much. I mean, our goal is to make each individual mom feel like we know her. We have staff meetings about this, just remembering that people process things in different ways, and if a mom retreats or lashes out or whatever, sometimes it comes from a place of anger or fear, or nervousness, or just uncertainty, and to just try to figure out what's the underlying concern and address it and help her to address it. Because again, your brain is such a powerful organ in terms of labor and delivery, and you want to go into birth all clear.
Yeah. So that's a great springboard. You just mentioned fear, nervousness. There's a lot of that going on right now. And I know that you are jumping through hoops, bending over backwards to try to support your mom. So let's go ahead and touch on a couple of the things that we have discussed already that we know are some of the prevailing concerns right now. So the first thing would be you're doing virtual visits and fewer face-to-face visits. And let's just talk about that and tell us some of the concerns, how you're addressing them, how you're still maintaining those connections and relationships emotionally, if not in the physical presence of the moms.
Sure. So, as you and I just kind of reviewed a little bit, ACOG has a model of how often women should be seen in pregnancy in general. And it's about once every 4 weeks until you're about 28 weeks, and then every other week until you're about 36 weeks, and then weekly until you deliver. If you go past 41 weeks, they recommend antenatal testing. World Health Organization on the other end really only requires or recommends 3 visits, so 1 per trimester, which to us here in America seems crazy. But when you look at what really needs to be evaluated and what really needs to be screened for, most of the time, and most women will agree, a lot of the visits are just coming in and saying, "Hey, how you doing? Still got that good blood pressure? All right, awesome." And and you're on your way. So a lot of that can be spaced out for women who are normal and low risk, and or combined, in order to minimize the actual patient contact necessary. You mentioned, what's going on right now with the concerns with COVID-19, and we kind of got a communication from the governor's office, as you did too, on a Friday at 4 p.m. saying no more patients in your office unless it's completely urgent. And then you're scrambling, trying to figure out how to restructure your practice. I mean, I know you have to touch people. And so for them to suddenly say to you, well, restructure your whole business and figure it out by Monday. I have become technologically savvy. I wasn't the most probably before this, but trying to vet different telehealth platforms and figure out how to submit these the visits and document them appropriately, and try to make sure that we were still taking the best care of women. OB being hands-on, we want to check the baby too. And that's really hard to do with a telehealth visit where you're just seeing mom from, the neck up. Mm-hmm. So we came up with some guidelines and requests for patients to purchase some equipment so that, we both on both ends feel comfortable with how we were evaluating them.
So you mentioned something to me earlier when we were talking, that there has been a little bit of misunderstanding about the equipment, or there's there's additional support available, and not everybody's aware of that. So tell me what you were saying earlier about a prescription for those supplies.
Exactly. So in the emails that went out to our patients, the first one just detailed what the 4 items were that we were asking them to purchase. One was a blood pressure cuff on Amazon. The link we shared, it's about a $26 cuff. Most people have a bathroom scale already. Urine dipsticks, which we were selling here in the office for $1.75 if they weren't able to find them cheaper online. And then the fetal Doppler, and the link that we sent was about a $55 or $58 device. We also sent out a prescription for them to present to their insurance companies to see if they could get reimbursed or have these things covered. And we let them know that they could use HSA or FSA money for it as well.
Right.
So the total investment was probably going to be around $75, which, we looked hard for those things, and, weighing the options or the risks of exposing yourself with the foot traffic in the office versus $75 investment to try to protect you and your family from COVID.
And I think under different circumstances, if your doctor says, I need you to buy these supplies so you can do some self-monitoring and self-field reporting, I think that would probably be taken in stride. But with the stress that's already in place around COVID-19 and all of the adaptations that we're having to make, I think that was probably just another layer of stress, frustration, aggravation, and
right. And we get it, like on both ends, because for us, we're used to just coming in, doing our little Leopold, saying, oh, the back's over here, and then we'll just listen to the baby. But now we're on Doppler saying, oh, no, move it down a little bit. Okay, press your belly. Do you feel a knee? You're not sure if that's a knee. Okay, feel on the other side. Do you think that's smoother or what? Like, it's not easy for us. It's not ideal for us either. We would much rather you just come in and we touch your belly.
Oh, cool.
But we also don't know who was in the office right before you. Were they coughing? We've learned this thing is airborne now and can last for hours in the air. We just don't feel comfortable risking our mom's, our mom's health.
Yeah, absolutely. So we're all just doing the best we can right now with what we're able to do. So thank you for clarifying some of that. Let's jump into the next level of concern, which has to do with the actual birth. And, again, we've talked about a few things already, mom's concerns, and I'm just going to go ahead and list them and then turn it over and you can just share. So one is the idea of setting foot in a hospital right now. There are valid concerns about that, but I'm sure you can offer some information to allay some concerns. And then what support people are being allowed into the hospital setting with mom, and then what happens after the birth with mom and baby. So can you just maybe give us some peace of mind about how you're managing all of that and what's allowed?
Absolutely. So to start with the concerns about coming into the hospital, labor and delivery, we deliver at St. Vincent Southside, and the family birthplace is a separate locked unit away from the main hospital. So, the labor and delivery staff are on lockdown. They're not floating to med-surg floors, floating to ER, ICU, or other places where we know that COVID is isolated and that patients who are positive are being kept. If there is a COVID positive patient on labor and delivery, they're kept in what's called a negative pressure room. So essentially they're recirculating their own air and not circulating their air out to other rooms on the unit. I think the main thing to just relay to people is that if COVID is at your hospital, it means COVID is in your community. And we know that here in the county, COVID is in the community. The purpose of having people stay at home is not necessarily so that nobody gets it, but just so that everybody doesn't get it all at once. At some point, the restrictions are going to be lifted. At some point, people are going to be able to come back out. And there is a chance that there will still be continued exposure even after all the mandates are over. Our goal is not eliminating the curve, but rather flattening it so that when people are exposed, there are enough resources to be able to care for them. The second thing that you mentioned was about what support is permitted. And I know it was a huge story in New York when they initially said women are going to be forced to give birth alone. And the major hospital systems that initially had those rules, it was Columbia, Presbyterian, I believe, and Mount Sinai. Actually, within a week, those were reversed, and spouses or significant others were permitted to accompany women in labor. There wasn't as much publication of the reversal of the decision as there was the initial, I think, shock and awe of being able to say women are alone. But no other hospital systems that I know of have followed suit for that original mandate. And there's no indication that is a plan for any of the local hospitals here. We're still allowed to have one visitor at a time. And so what a lot of my moms are doing right now is they're coming in with their doulas, and everyone is screened as they come into the hospital. So we're taking temperatures, we're asking about symptoms, and the doula is staying with them pretty much until the second stage or the pushing starts. And then we're having dad come in, and he's screened as well, so that the patients are still following the one visitor rule, but they're having the visitor who's providing them the most support at that particular phase of labor. The whole staff in labor and delivery is wearing masks. Your providers are wearing masks, as we are here in the office too. And we know it's not ideal. Like, everyone wants their doula and their mom and their husband and their birth photographer and all of those people there. But just right now, it's really about limiting foot traffic as many places as we can. And then there was one other question you asked, and I think I may have talked too much and forgotten it.
You've not talked too much at all. No, but that was good clarification about what's being allowed at St. Vincent. So doulas are being allowed in the room, just not at the same time as their other support person partner.
Right.
And I know that there are a lot of moms that are happy to be able to have that available to them. The last thing in that list was, after the birth, what happens with mom and baby? Mm-hmm.
Yes. Thank you for reminding me. So if a mom is COVID positive or a person under investigation, it will be strongly recommended that she use an isolette in the room, those little kind of plastic incubators, sort of, you can think of, that will protect baby from the respiratory droplets that are circulating in the room. Mom will be encouraged to wear a mask and use gloves when she's handling her pumping supplies, but we're not discouraging moms from breastfeeding. We're not discouraging moms from having skin to skin with their babies. We're not football tucking the baby under our arm and running out the door with the baby as soon as he or she are born. We want moms and babies to still be together, but we want to reduce the risk of transmission, because, ideally, skin to skin, your baby is right here, and that's where your respiratory droplets are out. And so we're going to try to encourage mom to use best practices when handling baby, but still to handle baby. It's your baby.
And mom and baby are in the same room?
Exactly.
All right,
exactly. We're not separating mom and baby.
Good. Okay, because I've heard some stories about that, and I'm sure that varies from one hospital to another, but good to know what's happening at St. Vincent. So lots of good and comforting information to, I think, bring peace of mind to moms who are with Full Circle or just birthing at St. Vincent's with other practices as well. So before we close, what else would you like to share? What are other concerns that you're seeing, or other things that you would like to clarify?
I think we really touched on the main things. I do want to, I don't want to make it sound like everyone is being difficult and obstinate. We've had some really amazing patients, and I want to take a moment to, in case any of them are watching right now, give them a shout out, because we've been getting some of the nicest messages. Some of my patients know that my older parents, they're 76 and 81, recently moved to Jacksonville, and they're around the corner from us now, and I have young children. They're 2, 4, and 6, and just really nice messages, just reaching out and asking how we're doing, how our individual families are doing, because I'm essentially isolated from my kids and my parents right now, because I'm the weakest link. I keep coming out into the healthcare community, but it's tough being away from them right around the corner from them, but it really means so much for the people who do view us as humans and are taking the time to check on us and make sure that we're doing okay. So just want to shout out our awesome patients at Full Circle who are loving on us as well.
Well, we are so grateful for you. And honestly, there's more that I would love to have an opportunity to explore with you. So maybe we can do this again when this part of life is behind us. And
That would be
we want to just share information about your practice and your cesarean rates and your VBAC rates and all of those things you have bragging rights to. And yeah, just really get some exposure to the people in our community for who you are. And yeah.
Well, thank you for that. And I do want to, then I'll tack on that our rates are not changing. COVID is not changing our C-section rate. So we're still having vaginal deliveries and VBACs every day.
That's good news. All right. Well, thank you so much for taking the time to share with us. And, like I said, bring some peace of mind to our parents out there. And we will share links to your practice, your Facebook page, ways that people can find and get in touch with you. And we'll talk to you soon.
Awesome. Thank you so much, Doc. It was good speaking with you as well.
Thank you. Bye.